The innovation of ECG-less Cardiac CT brings to my department the better workflow and the possibility for the entire staff to obtain these images. My name is Martin Lundsgaard. I'm head of radiology. I'm a radiologist primarily working within neuroimaging. A cornerstone in radiology is getting the images right at the right time, the first time you acquire the images. And to do that, we need technology, and we need technology that we trust in. And with ECG-less Cardiac CT, we can make the examination more easy, and we are quite confident that we get the images right the first time.
The benefit of the Apex is that we have 16 centimeter coverage, and that means that we can get the entire heartbeat scanned in one rotation of 0.23 seconds. My name is Nana. I've been a radiographer for 6 years, and I've been working here at this hospital for 6 years as well, being a super user at the Apex scanner for about 3 years. We use two features, a smart phase that lets the scanner automatically choose a phase in the heartbeat where there's least motion. And then afterwards we use Snapshot Freeze 2 that corrects any motion in the coronaries or in the myocardium. And that's a great combination for us, it works well.
My name is Claus Kofod. I'm trained as a cardiologist. I'm leading our cardiac CT unit, entailing both clinical and research activities on cardiac CT. ECG leadless is a great innovation because it allows the patients to be examined with great ease, and it's very easy for the diagnostic team to perform the test. The Apex scanner allows you to perform cardiac CT without pre-treatment with beta blocker, which is a really huge advantage compared to what we were used to before. Because all the logistics and the safety of the patient are completely different now where you don't need to do it.
The difference between ECG-gated cardiac and ECG-less cardiac is that you're able to scan the patient without any preparation. You don't need any ECG leads, and you don't need any monitoring of the patient. I think the three benefits for the patient is that it's a better overall experience for them because it's more calm, and I think it's a faster examination, so they won't be in the room as long, and the less you need to interfere with them, the more calm they feel.
For us, ECG-less Cardiac CT is just bringing CT to the next level. For now, a normal cardiac CT is some way quite difficult to do the examination because you need technicians, you need nurses, you need doctors to do medication for having the right cardiac beat during the examination. Also, it can be time-consuming to put on electrodes for the right sequence for the cardiac motion. With the ECG-less Cardiac CT, you could actually save some of those steps, actually making the examination more easy for daily clinical practice.
I would envision that the more it'll be adopted, the more it will kind of move cardiac CT into the central domain of any type of radiology examination, because it wouldn't require a specific kind of training, which is a huge advantage to kind of disseminate this type of technology to any radiology department. Whereas now, I think it's kind of considered a very, elite kind of thing that only few people can do it. But now it will potentially be possible for any radiology department to do it, which I think is a really great benefit for any healthcare system.
When I started using ECG-less cardiac, I found it really easy to set up the protocol. The colleagues I've taught ECG-less cardiac found it very simple to use. It was intuitive, the protocol tells you what it needs, and there's no complications.
The three main advantages of ECG-less is that it's very convenient for the patient. It's very helpful in the acute setting because it's very fast, and it's very user-friendly for the radiographer to do the test.
with the ECG-less Cardiac CT, we can democratize this examination, making it available in the acute setting 24/7.
Suddenly, we can broaden out the indication for CT, cardiac CT, in individuals we couldn't scan before because they weren't able to have their heart rate lowered, which is a really interesting clinical approach. And the second thing is now a broader part of the radiology establishment will be able to do these type of scans because logistics are so much easier than before where you needed a lot of preparation. In the future, I would expect that to expand also to include patients which are intolerant to heart rate medication, to pediatric setting where you would want to have motion-free images in these small infants. And potentially, obviously, this is also of relevance in training because more people will be able to do it because the operation of the scanner is so simple.
We find that using ECG-less cardiac gives us great image quality. And also I think using auto ROI will make the image quality more consistent, and which paves the way for better diagnostic image quality. I've enjoyed having the experience using ECG-less cardiac because it was fun to learn and it was fun to see how easy it was to use and simple to teach.
I'm hoping that ECG leadless will remove some of the boundaries that it currently is in cardiac CT so that more people will adopt this particular approach for diagnostic imaging because it's just so simple and you should do it.
In our department, we have the ambition of sharing the knowledge that we have gained. And with this new technology, ECG-less Cardiac CT, we can scan patients that we didn't scan gated before. And I definitely see that will be a change for the diagnostic within CT in the future.